So again, thank you for being here. Thank you for joining me. My name is Richard Yaden. I'm a registered nurse and a mental health and wellness coach here in Franklin, Tennessee. Also, at the end of this, we're going to go through a lot of information here. I'm going to try to get through it in a reasonable amount of time. And I'll have a couple of things that a couple of resources that you can get at the end of this here that coincide with a lot of what I'm talking about. So today we're talking about facing mental health challenges. And I'm assuming that you're here because either someone in your family or maybe a friend has a mental health challenge, or maybe it's yourself. And we're really going to be talking more in terms of how to help someone that is facing a mental health challenge. But if it's you and this is a situation that applies to you, then you can, share this information with people, family members or friends that will help you be a part of it as well. And I have to give this disclaimer because we have to do it and anytime we do something like this. I'm not going to be giving you medical advice. I'm not going to be diagnosing or prescribing anything. This is for informational purposes only. I can, within my scope of practice as a registered nurse, provide education. I can do basic assessments, and I certainly can do coaching within the bounds of my licensure as a registered nurse. And just to give you a little more background, I have a bachelor's in nursing from Austin Peay State University. I'm currently about 2 semesters shy of achieving my psychiatric nurse practitioner licensing and going through that as well. And probably this time next year, I'll be accepting patients for medication management and for diagnosing therapy and things of that nature as well. But for now, that's not within my scope of licensing, so I hope you understand. So let's talk a little bit about what we've got going here. And I want to begin by talking about mental health conditions, just really understanding some of the mental health challenges that people are faced with today. And if it's someone that if it's a family member or a friend, these are very, very similar to what they're facing and maybe very familiar to you as well. So mental health conditions are increasing. I'm not quite sure. Well, there's no one reason why that is happening, but we're seeing a big rise in mental health disorders. We're seeing a lot more people seeking help for mental health conditions. And unfortunately, at the same time, we have fewer providers that can help those people. What's one of the reasons I started my coaching business, and one of the reasons that I'm becoming a psychiatric nurse practitioner is because I see a great need for this. And mental health challenges are something that are pretty common, and they can affect anybody, regardless of their age, anybody, regardless of their gender, anybody, regardless of their background. And certainly there are environmental factors and genetic factors that can predispose someone more to having a mental health condition, but that's not always the case. Depression is probably the number one mental health condition that help is sought for today. According to the World Health Organization, depression is the number one cause of disability worldwide. I have worked many years in the emergency department as a nurse, and I see many, many patients coming in with complications from depression, anxiety as well, and other mental health conditions, but certainly depression is one of the big ones. And there are many common mental health disorders that you're going to encounter either in your family or from friends, and you may not even know that someone is dealing with one of these mental health disorders. Depression, we talked about that, anxiety disorders, bipolar disorder, schizophrenia, and PTSD are some of the more common mental health conditions. And these conditions can overlap each other. They can co-occur with each other, and many of them often lead to other disorders, such as substance abuse disorders. And we really don't classify a mental health disorder as a treatable type of condition until it has an impact on daily functioning. And many mental health disorders will hinder an individual's ability to maintain relationships or even to engage in the activities that they, once enjoyed and participated in. And that's why early detection, early intervention is very, very important. And another thing that is very unique with mental health, and this is something that we don't normally will see with physical conditions or chronic physical conditions, is that there's still a stigma. There are still misconceptions about mental health. There are misconceptions such as the belief that many people have as to, why doesn't somebody just snap out of it? Yes, you're depressed, but why don't you just snap out of it and get yourself back on track? And some people even view mental health conditions or disorders as a sign of weakness. So that's a misconception that's out there. And that type of misconception leads to a stigma around mental health. There's not as much stigma about mental health conditions today as there was, even 10 years ago, but it exists, and that hinders a lot of people who are dealing with a mental health challenge from actually seeking help or getting help that they need. Now, situations or environments that people can create for themselves and work them into that will create a mental health challenge, absolutely, there is. But that's usually not the case for most mental health challenges. There are other reasons, which is beyond this presentation for us to get into, that can create those things. And the other thing that I want to mention here is the impact of trauma, particularly childhood trauma. This has a huge, huge impact on mental health disorders. And many, many mental health disorders are linked to childhood trauma. And that's trauma is a subjective factor. It is something that is unique to each individual. And again, that could be a whole nother presentation that we could do about that. But I want you to understand that there's a lot of stigma, a lot of misconceptions about mental health disorders. Now, one of the things and the common challenges in mental health disorders that is very different from a physical health disorder, and that is there are really three, well, there are more than three, but there are three I want to talk about here that create a greater challenge for someone who's dealing with mental health issues. The first one, well, we talked about stigma, we talked about we didn't really talk about discrimination, but that's a big one as well. But access to treatment is a huge issue that creates challenges for mental health treatment. There are limited access. You or a family member may have encountered very long wait times to see a mental health provider, very long wait times to see a therapist. There are affordability issues. Until the last few years, a lot of insurance didn't even cover mental health conditions. That's changed. It's getting better. There are still some limitations to it, but all of these things can hinder an individual's ability to access and get treatment in a very timely and effective fashion. Social isolation is another issue that people with mental health challenges have to deal with. A lot of people will withdraw from social interaction. They isolate themselves because a lot of it is because of the stigma that is associated with mental health disorders. Some people will feel shame, embarrassment. There's a lack of understanding of people, within their family or their social groups about their mental health condition. And that creates a lot of isolation. And social isolation is very detrimental to trying to recover from any kind of mental health challenge. So it just begins to exacerbate the situation. There are crises situations. With some mental health conditions, they can be exacerbated, and they can grow into a psychosis. They can grow into a very acute phase. You may have some awareness of perhaps someone with bipolar that goes into a manic phase, someone with schizophrenia who can go into a psychotic episode, and that creates a real crisis. Many mental health conditions are associated with suicidal ideation. And I have seen this a lot in the emergency department that creates that type of crisis. So these are all challenges that people that are dealing with mental health issues face and have to work through. And if you're here because you have a family member that is dealing with a mental health challenge, or a friend, be aware of these things. These are things that they have to work through. And to the extent that you can help them with those, and I'm going to give you in this presentation some techniques and some strategies that you can use to help with these things, because this is pretty important. And that is caregiver burnout. And this is a very, very real thing. And this is where family members or caregivers experience burnout and exhaustion from trying to be the person helping someone with a mental health challenge get through it. They're providing support. And this burnout can lead to the caregiver's own mental health challenges, a quality of life, even physical challenges. So we're going to touch on this here a little bit more in just a minute, but I want you to be aware of that. Now, for family and friends of someone who has a mental health challenge, you have a huge, huge impact on their ability to recover, on their ability to cope with mental health. And I want to introduce the importance of supportive relationships when it comes to these things. The relationship someone has as they're working through a mental health challenge is a huge factor in their ability to recover. In fact, as a provider of someone who is helping a person with mental health challenges, we know from studies after studies that the role between a therapist and the patient has more to do with their recovery from a mental health challenge than anything else, than given the form of therapy, than any medications that they're taking. This transcends into your role as a family member or a friend of someone in a mental health challenge, because your relationship with them and how you can help them cope through that challenge is a huge, huge factor in how well they do and how well they do with it. And I want to talk about 3 different types of supportive relationships. We're going to talk about emotional support, practical support, and social support. Emotional support. Now, what is emotional support? How can you help someone with a mental health challenge through emotional support? It comes down to some pretty simple things like providing comfort, validating them, and reassuring them through difficult times that they're working in. Empathetic listening is another way, and validating their feelings. You don't have to necessarily agree, but you have to validate that, yes, you understand they are going through a tough time. That's how you're validating their feelings and giving them expressions of care and concern. All of that goes a long way in providing the kind of emotional support. Now, for some people who may be in a very severe depressive episode, or someone who is in a very severe bipolar depressive episode, they may not acknowledge this type of support. But believe me, it is sinking in. It is there, and they can grab onto it even just by a little straw, and it makes a huge difference in their ability to deal with the challenges that they're going through. Practical support is another way, just offering to help with daily tasks, daily responsibilities for someone that's facing a mental challenge. You don't want to take over their life. You don't want to get in a position where you're providing so much practical support that the person doesn't have to function. But if they're going through a difficult time, stepping in and saying, hey, I can take the kids to school or to the doctor's appointment, or hey, I can run to the store and pick that up, or go pick up your prescription, whatever it might be. Those are kind of very practical ways that you can help someone through a mental health challenge. And then social support is also very, very important. Having them connect to social networks, I don't mean online social networks. Heck, things like Facebook, TikTok, or whatever it might be. Sometimes those things can be very detrimental to mental health, but social support networks like peer support groups, a depression recovery group or a PTSD recovery group. There are online communities outside of social network platforms that are geared specifically for different types of mental health issues that you can steer them towards. But social connectedness is a huge, huge factor in determining or in helping someone overcome a mental health challenge. To give you an example, In my training, I was doing rounds with a psychiatrist at a hospital, and we had a elderly lady that was brought to the emergency room by her family because they felt that she just wasn't acting the same, just was not herself anymore. And as we did our assessment, we found out that this was a woman who is extremely, extremely lonely, and that the psychiatrist's prescription wasn't more medicine. In fact, we withdrew some of the medicine that she was on because we felt that may have been contributing to some of her loneliness, and to get her connected socially. Fortunately, the family listened. Fortunately, the patient listened, and we came back a couple of months later and followed up with her, doing much better. And the biggest change was that she just got connected socially. So you've got to really, if someone is facing a mental health challenge, isolation is one of the worst things that they can do. Helping them get connected socially is very, very important. Even if it's just you and another person, that is very, very important. Now, we talked about this issue a little bit earlier, but I want to touch on it again because it's very, very important. And that's the importance of self-care for caregivers. If you're someone who is a caregiver, or if you're trying to help somebody through a mental health challenge, and believe me, all of your good intentions can cause you to get sucked into a situation where you are now a caregiver that is neglecting yourself. And that's something you just can't do. I mean, you cannot help somebody if you're always sick, if you're always tired, if you're always fatigued and burned out. So when we talk about caregiver burnout, we're really describing a state of physical, emotional, mental exhaustion that results just from the stress of prolonged caregiving. You might be familiar with this if you know of anyone who has been the caregiver for someone with progressively worsening dementia. That can just really suck the life out of you if you're a caregiver. And that doesn't mean they're not well-intentioned. And I applaud anybody who wants to step in, particularly an elderly spouse who is trying to care for their spouse of many, many years at home that has dementia. I mean, that is just a wonderful thing. And anything we can do to help support that person, we want to do that. But they need care as well. So how do you know that you might be getting to that point? Well, some of the signs and symptoms of caregiver burnout, and you might notice this in other people, is fatigue. It's irritability. They become withdrawn. They have feelings of just being so overwhelmed about what is happening. And if you're noticing somebody like that, then that's something that you want to help them address, and to the extent you can address it as well. It can affect them from a physical standpoint as well. We see an increase in illness with caregivers, and a lot of it's just from the exhaustion of doing that. They have to have time to replenish. They have to have time to recharge. They have to keep their energy reserves up and be available to help care. Some of the types of self-care for caregivers, if this is you or you have a family member that's in this situation: exercise, adequate sleep, make sure they're getting regular checkups so that they are not going to get themselves into a chronic health condition. Emotional support, help them set boundaries, which we're going to talk about here in just a minute. Very important when you're helping somebody through a mental health challenge is for you as the caregiver to have boundaries around that. If there were things that they used to enjoy doing, hobbies or activities, encourage them to get involved with that, or maybe step in and give them the time to go get involved with that. Them maintain a level of social connectedness so that they can also not be in an isolated situation. So very important, caregiver burnout. So let's talk about some practical strategies that you can engage in for supporting somebody or helping somebody through a mental health challenge. And these are things that I'm going to give you 3 of these. I'm going to give you communication strategies. I want to give you some environmental strategies. Equally important, some boundary setting strategies that you can work through. This is something you might want to take notes on. As again, at the end of this, I'm going to show you how you can get some of these things sent to you, so you'll have a sheet that you can refer to as well. Let's talk about communication techniques first. I think it's real important that you begin to practice understanding and patience. Sometimes someone with a mental health challenge cannot respond as quickly to situations as maybe you or I could when we're not having a mental health challenge. You've got to be able to know how to communicate support and support for them seeking professional help. Make sure your communication style is empathetic and it's respectful. Don't demean them and it's exacerbated by the situation. It's easy to fall into that. You're not being respectful in the way you're communicating with them. And again, patience and understanding is absolutely key when you're trying to help someone through a mental health challenge. Now, let's talk about practical strategies for support in creating a supportive environment. The great things that you can do, one of the very effective things, is to help someone normalize their experience. Sometimes when a person is going through a mental health challenge, they feel like they're the only person that's going through it, that there's something just so wrong with them. Even in my own family, I have someone in my own family that is suffering with depression, and they feel like they use the word crazy all the time. What's wrong with my head? I'm crazy. You have to help that person normalize their experience. Yes, you've got a mental health issue, but it's not any different from someone who has a cardiac issue or someone who has a GI issue. It's an illness. It's got to be worked through. It has to be treated. And that's how you help them normalize what they're experiencing. Provide practical support. We talked about that earlier. Some different ways you can give practical support. Patience and understanding. Again, you're going to see that a lot when you're dealing with mental health challenges. The other thing that you can do, and I learned this a lot in my nursing background, is to model healthy coping strategies and model the type of coping strategies you would want them to display as well. Of course, celebrate progress. Anytime somebody who is dealing with a mental health challenge makes a step forward, that has to be celebrated. Because often, unfortunately, in treatment processes for mental health, there is 2 steps forward and 1 step back type of treatment that happens. In fact, in a lot of therapy modalities, it is very common to expect a regression once the therapy process ends. So when you begin to celebrate the process of progress, when you begin to celebrate that, it goes back to that very first point here on the screen, which is normalize their experience, that they feel like they are moving forward. Last thing I want to talk about here is setting healthy boundaries. This is essential. You have to set healthy boundaries for yourself and for the person that you might be giving care to. One way is to clarify your role. That's for you to define. How is your role going to be defined when interacting with that person? You got to make sure you clarify that. You have to identify what your needs are, not just the needs of the person that you're helping, but what are your specific needs? Set clear limits. How far are you going to go? How much time are you going to be able to invest? How much time are you going to be able to spend? How much money might you expend in this process? Then be respectful of your own boundaries. Don't move those boundaries. There may be situations where it might be appropriate, but don't move your boundaries if you can. And practice assertiveness. You have to advocate for yourself oftentimes in these situations. While boundaries aren't probably a big deal day to day, in a crisis situation, they often can be. And we've got to be careful of that. So the main points here we're talking about: make sure if you're the provider or if you're the caregiver, or you have somebody in your family that is the caregiver, then let's make sure that we practice self-care. We want to create supportive environments. I've talked about those a little bit, and setting boundaries, not only for yourself, but for the person that you might be involved with. Okay, so some questions have come in, so hang on just a second. All right, someone asked, do you provide private consultation? Yes, I do. If you go to the website, mindcarehealth.us, there should be some links for you to set that up. You can also email me at info@mindcarehealth.us, and we can work something out to do that. How to process my coping skills while trying to help someone else? Great question, Kendra. And it's difficult to do. It's very difficult to do. I think before you engage with the other person, then you've got to really understand what's going to be your points where you are going to have to use coping skills. What are the kinds of things that you think are going to be difficult for you to overcome? Know ahead of time what your coping skill is going to be for that. It's a great question. It's a little beyond what we could cover in this full session or this presentation, but I think knowing in advance, and one of the things that that you'll have access to if you want is a crisis intervention worksheet where you can go through and fill out what you think you need to do about and how you were going to cope with potential situations that come up. All right, Mary Ellen would love to know where I could find more information on providing social and emotional support. Good point. I can I can send you a few tips from this right here. There are a number of organizations that are usually specific to a mental health condition that you can go to, and they have a lot of caregiver support techniques on that organization. For instance, let's just use dementia as an example. The Alzheimer's Association has a ton of information for caregivers. I believe there's one for almost every single mental disorder. If you want to email me privately about a specific disorder, I'm happy to send you an email back about that as well. Good. Thank you, folks. I appreciate the feedback. Here's the email address that you can use on the screen right now. If you want to get a couple of things that I put together, there is a communications tips worksheet that you can get, and then there's this crisis planning worksheet as well. If you go to www.mindcarehealth.us/facing for facing mental health challenges, it'll show you how you can get a hold of that. But that communication worksheet is going to give you some insights, some practical strategies for effectively communicating with someone who has a mental health challenge. And then having that crisis worksheet on hand really empowers you to proactively plan and prepare for a mental health crisis or acute episodes. The worksheet will help really facilitate kind of creating your own personalized crisis intervention plan, and that's tailored to whomever's specific needs and communications. So you can get those there. Oh, one more question has popped in. How do we communicate with someone when they don't want to communicate properly? All right, I'm not sure. We're almost out of time here, but I'm not sure what you mean by communicate properly. So if you've got somebody who's just kind of shut down and they don't want to have anything to do with you, whatever, you can still use the same communication techniques. This is where the patience and understanding comes in. They will come around. What you do and what you say will set in. Real quick story, was in the emergency room. We had a psychotic patient, schizophrenia. They were off their medications. They were in a situation called selective mutism, where they would not speak, almost catatonic type of presentation. And I did a lot of communicating with them, try to provide a lot of support. Didn't seem like there was any kind of response. But 4 months later, that person came back to the emergency department and sought me out and said, one, apologized for their behavior. There was no need for them to do that, but said the things that I talked to them about really set in with them and made a difference in their experience while they were there. Just keep doing it, and believe me, it sinks in. It gets there. Okay, folks, I appreciate your time on this Thursday afternoon. So thank you again for your time, and look forward to our next. I'll do another one of these on a different topic here in the next month or so, and hopefully you can join us then. Have a great one. Thank you.